You are invited to join us around the conversation of the history of occupational group therapy in South Africa. So have got two dates, the 19th of September and the 17th of October. We will have online discussions to track the history of occupational group therapy in South Africa over the last 80 years. So OTASA, our Occupational Therapy Association of South Africa, is turning 80 years this year, and we are having a more in-depth look about our history and where we come from, which I believe is so important. Unless we understand our roots and know where we come from, but also know the decisions and choices we've made along the way and how it has shaped where we are today, it can give us a really good navigation of how to go forward from here. So, of course, with any history, it's limited. My perspective of the occupational group therapy history is limited from when I entered and even before I graduated as a student, remembering the groups that we did at Weskoppies Hospital, which was a government hospital, psychiatric hospital in South Africa, in Pretoria, and just remembering the most amazing groups that were run there. Still at that time, we had industrial therapy. So the really long-term chronic patients would go in and almost like a sheltered employment. They would make flowers, funeral flower, plastic flowers. We had a woodwork section where woodwork was done. We had groups for vocational rehabilitation. We had groups for acute intervention in which psychodrama, projective techniques, clay work was used. We had lots of drawings, draw yourself as a rose bush. So that was the background in which I grew up in the landscape of the occupational group therapy history. Then after I graduated, I was very fortunate to work at Weskoppies Hospital's adolescent unit for more than 5 years, and that shaped a lot of my thinking in terms of groups. I had groups at least once a week, once a day, sometimes twice, and in holidays I even had three kind of group sessions running for the participants, for the adolescents that had been admitted. And so that shaped a lot of my thinking around groups, a lot of trial and error learning that happened as I was trying to find my own feet as a graduate, but also had an incredible MDT team that supported me. I had a mentor, Vivian Oosthuys, and a psychologist who really took me under her wing and would show me things behind our one-way mirror as therapy was happening that informed a lot of the ways that I have continued to grow in occupational group therapy. And then I left the Weskoppies Hospital and joined University of Pretoria and did lecturing in mental health second, third, and fourth years, and then also did the group module for the third years. And again, lots of trial and error, made mistakes, learned from it, helped to shape me. Read Yalom's textbook on group psychotherapy and his inpatient setting, did my postgraduate diploma in interpersonal relationships and group activities. And again, a lot of these things shaping the way I facilitated groups, but also shaping the way I was thinking about groups. Lots of literature I read, Linda Finley, Jennifer Creek, all of those big names at that stage, especially in group therapy facilitated by occupational therapists. And then after I left the university after 8 years, I took a little bit of a break, thinking maybe I was finished with occupational therapy, which was not to happen. I then came back as a founder and director of OTGrow with a huge need of therapists contacting me saying, please, they would like more input with regards to groups. How do they facilitate groups with patients? And even that journey has been shaped and changed as I have been with OTGrow for 15 years, moving into other spaces, moving into spaces of community, moving into space of corporate, moving into spaces of training, seeing the application of groups in a whole host of different settings. But apart from that, I was very much exposed to what's happening at different clinics, different universities, different government departments, as people would come for training and share their story and what was happening. And I think one of the biggest changes that has happened is that the free rein that was given for occupational therapists in the 1980s and even beginning 1990s, in terms of we were masters of our profession, we had the science and the art of group therapy. And then for some other reason, we went in that direction of not just life skills and social skills, but that a lot of that started changing into giving lectures or classes. And even some of the patients I would meet would say, I'm going to occupational therapy classes. And somehow that knowledge, just giving on continuous knowledge, started shaping a lot of the ways that occupational therapy groups were perceived and seen in the multidisciplinary team. There came a misalignment between what was happening at a training level and what was happening at the implementation level. And somewhere there, we started finding that our scope became more and more limited. People started frowning when we wanted to do the occupational group therapy that we'd done in the 1980s and beginning 1990s that included psychodrama and projective techniques. And more occupational therapists became skittish and felt that it was too evocative for our clients and that we should hem it in and that we shouldn't provoke our clients. And the more we actually adhered to that, the more the MDT teams did not appreciate when we did want to reclaim the old way of doing occupational group therapy. And so we're sitting today where there's a lot of things happening that I think is important for us to have a closer look and decide, is this really where we want to be? Is this where we want to go? There is almost now, I don't want to say exclusively, but there's a lot of groups facilitated in the more private clinics that are still very much lecture-based, giving information, asking a question here and there, and the structure of groups is being lost. And I think that's really sad. There's been a big influence that came in with mindfulness, which is a good thing. But as that became kind of more, again, kind of giving information, even the DBT, a lot of giving information, we have lost some of the art of our occupational group therapy. But this is my perspective. This is the way I see it. And so I'm urging you to join the conversation. What have you seen? What are you experiencing? Maybe I am biased in terms of what I've heard from people when they come to our training. And so you are invited to this conversation to help shape and for us to make sense of our roots and where we come from in terms of occupational group therapy in South Africa. So please join us on the 19th of September, or we're going to have another one on the 17th of October. We will be inviting some big names to share their perspectives, and I hope that you're going to be joining the conversation. So maybe after everybody's had an input, we can have a couple of more people on our YouTube video who can draw it all together and almost show us a way forward in terms of occupational group therapy. So please join the conversation. I hope to see you there.